At ECA Consulting. And over the next 20 minutes or so, I'm going to show you why sustainable healthcare is not just charity work, or is not charity work, it is actually excellence in healthcare. Esan. Anyone going environmental? I know when we talk about environmental, there's always an avalanche of climate headlines and terminology that can leave everyone feeling a bit environmental. And yes, that is my shameless play on the word mental. So to keep the conversation clear this morning, and to preserve our collective sanity, I'm going to focus on three things today, just to help us frame the discussion this morning. What is the problem? All right? How everyday clinical routines add up to a surprising large ecological footprint. Why is it an issue? We have a problem. What is the problem of the problem? The mix of ethics, legislation, and professional duty that says we must act. But we know that crises can be catalysts for change. So what can we do about it? And we'll end off the session with some practical tips on how you can implement and green your medical practices. So let's start off. I hope you're all ready. So what is the problem? When talking about the problem, we must understand that climate change and ecological degradation are no longer distant forecasts. They are the single greatest existential threat to humanity that's happening here, right now. Let's put this in context. Here at home, South Africa is the 12th largest greenhouse gas emitter on the planet. We are twice the average per capita as we are a coal-dependent economy. Can you believe that we produce 55 million tons of waste a year? 90% of that waste is going to landfills. We haven't had a single new landfill in the last 20 years. We sit amongst the 30 driest countries in the world, but South Africa uses more water than the global average. 83% of our carbon dioxide emissions still comes from coal. In the last 5 years, we've had 4 1-in-100 flood events alone. Numbers are fantastic, aren't they? And I really feel when you need to understand the impact, you have to quantify this. So why is it even an issue? Take a look at these pictures. A lot of us that are from Durban, in KZN knows since 2017 we've had some major storm events. The last one in 2022, Durban experienced South Africa's most catastrophic flood on record. Emergency departments were flooded, medicines were destroyed, and staff were stranded. Extreme weather is no longer theoretical. It's happening here, now. The biggest impact was the data was ignored. This 2022 flood displaced over 40,000 people. I want you to contextualize this in terms of the healthcare sector. Where does the healthcare sector sit within this ecological footprint? If global healthcare were a country, it would rank number 5 in the league of polluters across the world, contributing 5% of all greenhouse gases. In South Africa, that number is 2.5%. Specifically looking at South Africa, our ecological footprint, and I wish I had more time to explain the difference between ecological and climate footprint. I'm not just talking about climate emissions. I'm talking about everything, a holistic picture. Our footprint sits with the electricity we buy. So 40% of our footprint hides in electricity, and around 13% comes from direct emissions from hospitals. Looking at some data from the Healthcare Without Harm study, which many of you may have heard of, 3/4 of South African healthcare emissions sits in Scope 2 and Scope 3. What does that mean? It is not emissions that we directly own. This is purchased electricity. This is the amount of waste we generate and we throw away on a daily basis. drugs, devices, travel, things most clinics never measure. All of the data I have shared so far highlights a very apparent ethical contradiction. The healthcare sector has a mission to heal, but the impact of that mission inadvertently fuels these climate impacts: heat stroke, asthma, flood-related trauma. This is the context your patients walk into your clinic with. Is that not a Hippocratic contradiction? So it's not all gloom and doom, and as I've mentioned, crises are catalysts for change. But before I can tell you what can you do about it as a healthcare professional, many of you must be thinking, why should you even bother? But I'm glad that Sheikh has already laid the foundation. And to take that a step further, many of you will be saying, I'm already so busy saving lives. But did you know that there is a global trustworthy index that was performed over 32 countries across the world? 58% of people rank you as healthcare professionals as the most trusted professions. This is among scientists, teachers, and the military. Doctors are considered society's role models. Change is powerful when it comes from the most trustworthy professionals in the world. When you change practice, society follows. I really hope you're on board. So what does sustainable or green healthcare really encompass? It definitely seems like it's a difficult concept to flesh out. But a lot of the legwork, fortunately, has already been done for you. Healthcare is bigger than recycling. It touches on leadership, chemicals, energy, transport, food, and greening the supply chain. If you look at the information on the screen right now, a very key initiative to sustainable healthcare is done by the Global Green and Healthy Hospitals. And they put sustainable healthcare into these nice 10 little boxes that you see there. Seems like a lot of information, but I'd like to simplify this for you. And if there's anything that you remember in terms of the principles of sustainable healthcare, it's the 3 R's of environmental sustainability: reduce, reuse, and recycle, in that order always. So the reason the slide is here, it probably just seems like I've thrown it in. It's really to show you that the concept of sustainability isn't just a romantic notion. This concept wasn't invented by tree huggers. It is founded and supported by numerous pieces of legislation in our country. Key to that is the National Environmental Act, that at minimum every person in the country has a duty of care. Whatever profession, no profession, everyone has a responsibility for duty of care. Very critical to the healthcare industry is the National Waste Act and the Healthcare Risk Waste Regulations that demands segregation of waste and cradle-to-grave tracking. So this is important for how you handle the waste that your facilities generate and other waste as well. Regarding emissions, especially when you're looking at hospital level, is the Air Quality Act, and then taking that further is the Carbon Tax Act, and the most recent promulgated Climate Change Act. I want you to keep your eyes out on that because the Climate Change Act will eventually set targets for your specific industry. So I've spoken about a lot of data and implications, but what does this mean for you as a healthcare professional? How can you make a change? So let's talk the how. Considering the stats and the sustainable healthcare principles that have been adopted globally, what I've done is that I've condensed this into 5 critical elements that is central to any sustainable healthcare approach: energy, water, waste, travel, and green supplies. Essentially with energy, if it's not in use, switch it off, put it in sleep mode, reduce your energy consumption. I think every one of you that, we've been a victim of load shedding, we've seen the rise in electricity bills, you know that the biggest cost and the biggest impact comes from the energy sector. Also, we have a lot of water volatility. We don't have a steady supply of water. We are a water scarce region, so reduce the consumption of potable water. Where possible, install your rainwater tanks. Reduce consumption of potable water. When we talk about waste, we need to be reducing the amount of waste that we actually throw away. Start implementing recycling programs. Travel is a very easy one there as well. We need to reduce the amount of kilometers that we're traveling. I'm talking about international flights, local flights, encouraging carpooling, and greening the supply chain management. You'll see in your industry there are a number of providers that actually provide the eco-friendly solutions or products. At the center of this is, of course, buy-in from staff, from all of those that support your initiatives, your medical practice. It will probably take me another day just to stand here and take you through the details of each of these elements, but I want to focus just a little bit more on energy and waste. So energy and waste is definitely, we're aiming at the low-hanging fruit. If there's a single most important place to start and make the biggest impact, this would be your energy consumption. And this even goes for the average person at home as well. Remember, South Africa is a coal-dependent economy, and over 80% of our emissions and electricity comes from coal-fired power stations. Things to consider are LEDs. The payback on those are definitely under a year. Using smart thermostats, literally take off 5 to 10% of your HVAC emissions. And many of you would have seen on medical equipment, you would have the Energy Star logo on there. That itself is telling you that that is a good option. That reduces the amount of power that you're using there. So just as a sidebar, you'd see that every kilowatt hour saved avoids half a kilo of coal and 1.3 liters of water, and that inadvertently saves half a kilo of carbon dioxide in going into the environment. So that's just from every kilowatt hour saved. Another significant aspect to consider is waste management, and the critical component here is that we need to divert waste away from landfill. And that is the important principle that you need to remember. And remember, waste management is governed by legislation. So please familiarize yourself with the relevant pieces of legislation. In South Africa, every ton of recycled paper saves up to 17 trees, and a cubic meter of landfill space is avoided. There's a lot of work that's been done into using reusable medical supplies, obviously where it permits, in terms of ecological solutions, and that definitely must be explored. Where waste and energy is connected, look at going electronic. Look at converting all medical records into an electronic format. Your thumbs are definitely far greener than your printer. Lots of input here. And the best way to put all of this into action and make it into an actionable plan that can be measured is actually looking at a green medical practice plan. I'm just going to show this quickly. So at the core of this, number one is to create an awareness, get staff involved, and start with an environmental policy and what it is that you want to achieve. Identify the key areas that you feel that should be within this plan, and most notably starting with energy, waste, and travel. You need to be able to measure against something. So of course start with the baseline audit, and if you're having problems with that, you feel free to give me a shout. I can help you with that. Then you need to assign responsibilities. Who's responsible for what? And it's best if all staff are involved. And you need to put in a plan for continuous monitoring. Okay, so I have spoken about a lot. I hope you're not going environmental. And just to emphasize that the global conversations around sustainable healthcare are definitely very loud. There are initiatives upon initiatives, material, data programs, toolkits, you name it, and there's a lot of information out there, so there's no excuse not to start. I just want to mention a few of these. The Global Green and Health Hospital Program is a global program with over 2,000 members, 70,000 health facilities across 87 countries. Did you know our very own Albert Lutuli Hospital is part of this program? Also, there's some hospitals in the Western Cape. In fact, I believe we've won a few awards on that. They have tons of resources, and I urge you to check that out. Another one to look out for is the Mind Green Doctor program. That spans across, can you believe, they have 41 million practitioners that are registered on their program. In terms of data, I want you to follow the Lancet report. The Lancet report is a publication that details the impacts of the healthcare industry on the environment and where those various emissions are coming from. More closer to home, we have the HPCSA guidelines on ethical practice, and key to that is environmental sustainability. So, respected members, I have come to the end of my talk this morning, but it's only the beginning of our green journey together. Healthcare footprint is big, but the solutions are in our control. Only when the last tree has died and the last river has been poisoned, the last fish has been caught, will we realize we cannot eat money. To capture the essence of the session, I want to quote the majestic words of Surah Baqarah, reminding us that we are successors upon the earth. The very foundation of sustainability has already been laid 1400 years ago. So thank you again for this platform. The cure begins the very moment you leave this room. Switch off the light, segregate your waste, question every purchase. Every kilowatt, every sheet of paper, and every kilometer you save heals your patients twice. Once today with cleaner air, and again with tomorrow with a climate that still supports life. Thank you so much for your time, ladies and gentlemen.